We need to understand the patient preferences. So a part of this care plan really should be asking what the patient is preferring in terms of when do they usually wake in the morning? When do they usually shower and bathe? Can we work certain tests and procedures around what is the normal rhythm of the patient's day when at all possible, particularly for our longer term patients. And again, recognizing the challenge of traveling patients who might be on a different time zone and be really adjusting to a lot. It is so important that we're also engaging in shared decision making. So not falling into a more authoritarian or paternalistic role of this is what's going to happen to you, but whenever possible, offering those choices to our patients. We have perhaps one of two medications that you can take. We can perhaps offer a medication or look at very changes to your diet that need to be made before we go right on medication. We have this type of therapy available for you or this type of therapy. We can try a therapy or a surgical intervention. So we really want to make sure that the patient has all those options outlined very clearly for them without the bias of us as practitioners of what we might think is the pros and cons, because we want to respect what is important to that patient through shared decision making. Another important point of communication is really the opportunity for the patient to engage in a conversation with a practitioner around their shared medical record. So we want to see that there is a dialogue, a discourse where the patient, if they so choose, has that opportunity to view their medical record and learn from it and ask questions with the provider. This is not something that everyone wants to engage in, but once they do articulate that they would like that, or better yet, if that opportunity is offered to every patient on a consistent basis, those that want to see that record have the opportunity to do so. Likewise, we want a very comprehensive discharge plan. This does come back to what happens when that patient is released. What does that care partner who lives at home with that patient and will be taking care of them? What do they need to know? It's very stressful once that patient is home. And even though a lot may have been taught, we want to make sure we're providing very comprehensive, easy to understand guides of what needs to happen at home. Because in times of stress, as we all know, it's easy to forget things. And that's why the teach back methodology, making sure that you engage the patient and the care partner in teaching back what those procedures will be once the patient is discharged, so they have a better understanding. And continuing to think of our communication shortfalls. And this comes back to that first slide we had on 80% of those medical errors are tied to some types of handoff communications when we have those shift changes and when we're transitioning a patient from one practitioner to another one. So please lead with RESPECT, the famous song, thinking about how we need to really respect each other and understand that there are barriers in communication, perhaps amongst practitioners, very busy schedules, a lot of stress is going on, and really just take a moment to breathe and think through, this person is going through a lot. Let's calmly both keep in mind what is best for the patient when we do that handoff. Make sure that we're getting important test results to the right staff person on time. This is actually at the heart of the 2024 National Patient Safety Goal by the Joint Commission that's focused on communication. The element of that goal, although it specifies really broadly communication, it drills down into making sure that test results are getting to the right person in a timely fashion. So this has been a shortfall of many organizations and one that we can all work towards improving. Engaging in bedside shift report. So making sure that not only are the two practitioners communicating about the handoff process for the patient when the shift is changing, but also that the patient and the care partner are engaged in these processes also. Likewise, as a part of that bedside shift change, if you're using any type of whiteboards or any type of other communication mechanisms, that these are accurate and up to date. It's a very stressful situation if a patient is lying in a bed and they see that whiteboard and this information is not current because they are laying in the bed facing that and wondering what is going on. While they can be and usually are a wonderful tool, like most information, if what is going in is not accurate, it can be a real shortfall also. So we could do a whole day of the forum, and perhaps we will in the future, on understanding disparities and challenges with healthcare literacy. So it's difficult to just go over this in a short time, but I would feel, very remiss if we didn't touch on this, especially in terms of what we need to focus on in communication. So leading with every patient with compassion and empathy, that is critical, with patients and family members and with each other as well. So understanding also among staff members, we all may be coming from different places, different experiences, different countries, different backgrounds, different cultures, different religions, and keeping that in mind all the time. So with health literacy, there may be variabilities in understanding just because of what we've been exposed to. It's not necessarily what our level of education is or where we're from. Also understanding how health literacy with the patient can impact patient safety. If the patient is not understanding what's going on, there is a much greater risk for medical error and safety incidents. So if we can refrain from falling into our coursework, our residency, what we learned in nursing school, and using a lot of medical terminology that we're very used to on a day-to-day basis, and really coming to explain things in more of a layman's sense and easy to understand terminology that is really readily understood by people who may not have a medical background. Even those who do have a medical background, understanding the stress factor of being in a compromised situation, being vulnerable, not feeling well, and being very worried. So making sure that we're coming at a patient with that in top of mind, leading back to that compassion and empathy. Providing all sorts of different alternative resources, particularly when a patient is not their primary language is not that of what is spoken in our organizations. If we have some pictorial resources, some diagrams, some other opportunities through translation and other mechanisms to make sure that everything is well understood by the patient, and recognizing that there are challenges and that we need to continue to work on addressing these. Likewise, understanding that there are disparities and access issues that are both local and global challenges. So particularly, many of your traveling patients may be traveling to your organization because of lack of access. In their particular home area, they aren't able to get the procedures that they need, or that there are disparities in what is offered in terms of ability to pay. I know in the United States, oftentimes medical travel is born out of the inability for patients to pay for the astronomical cost of healthcare in the U.S., and this necessitates travel outside of the U.S. Likewise, in many countries, access is an issue. If there's a particular procedure needed, there may be a very long wait list for that procedure to take place within the organization. So also we can address this through supporting our staff. And this is critical because, as we know, staff members that are not well cared for and nurtured and listened to and honored themselves can't in turn deliver optimal person-centered care. So we can do this through our daily huddles, going over safety events, special considerations for particular patients. This can be celebrations and also recognizing when things aren't going well for a patient. Understanding the power of storytelling for our patients, and also promoting not only a culture of safety in terms of reduction of errors and quality, but also a safe, just culture where people feel free to have the opportunity to speak up, and they have no fear that that will result in any type of disciplinary action or retribution. Making sure your leaders are visible. Staff feel supported when the leaders are on the floor, they're rounding, they're in the trenches, so to speak, with all of the staff, understanding what the problems are, what the challenges are, wearing the shoes of those staff members on the floor and really addressing problems as they arise. Providing spiritual and psychological support for staff members, and also, of course, various amenities, rewards, and recognition for the staff members as well. So let's talk a little bit about what is specific for the traveling patient. They have increased fears and vulnerabilities. Not only they are faced with a medical situation, they also have to travel for their particular situation to address this. And we all know how stressful travel can be. Even a short trip of 1 or 2 hours, going through the airport, getting to the airport on time, dealing with luggage, dealing with crowds, dealing with uncertainties, flight delays, all of these things that are happening more and more in the world today. So couple that with that very stressful situation of a healthcare incident that has occurred or presented to a patient, and feeling uncertain about traveling with that particular condition as well. There's also worries about what is happening at home, and perhaps issues around payments, communication challenges, and challenges from their primary care provider at home. Oftentimes, those providers may not be supportive of the choice of and the decision to travel for the healthcare. So we have many considerations for quality in medical travel, and Global Healthcare Accreditation has really addressed a lot of these in the need for best practice and protocols for all sorts of things, from pre-arrival through business ethics, patient rights, financial transactions, communication, travel and tourism, patient advocacy, and others. But we really want to focus on this diagram where we have the entire travel continuum outlined. So really that whole care process for the traveling patient happens well before they leave their own home. And making sure that, again, we're coming back to the communication and education needed for that traveling patient throughout the continuum of care. So a part of your organization's performance and growth is really looking at, quality, patient safety, staff safety, patient experience, accountability, and continuous improvement. And really recognizing that safe, person-centered organization is going to result in more patients for your organization. We want to pull it all together by combining all of these pieces as if it was a puzzle, and not isolating patient experience, patient safety, quality here, communication issues there, staff education, patient education. We want to bring all of these things together, and that will result in the optimal growth of your organization as a high quality, safe, person-centric organization. I want to thank you so much for your time today. And please don't hesitate to contact myself or Dr. Somporn with any questions. And I am delighted to be here and start your morning off. Thank you so much for the opportunity.